Welcome to Verified RX, your prescription for success. Brought to you by the Vizient Center for Pharmacy Practice Excellence.
Information on COVID vaccines is moving fast. Just recently, HHS Secretary Robert F. Kennedy Jr. announced that COVID vaccines will no longer be universally recommended for healthy children or healthy pregnant women. That's a big shift, and understandably, it's raised a lot of questions. Today, we're going to cut through the noise. We'll take a look at where things stand, who's getting vaccinated, how current guidance is evolving, and what this means for both children and adults as we look ahead to the next respiratory season. To help sort it all out, I'm excited to welcome back my colleague, Dr. John Schoen, Senior Clinical Manager of Drug Information here at Vizient. I'm Stacy Lauderdale, Associate Vice President at the Vizient Center for Pharmacy Practice Excellence, and your Verified RX host. Welcome back to the podcast, John.
Oh, thanks, Stacy.
John, we wanted to have you back on the podcast because it seems like every week now there is a brand new announcement about the COVID-19 vaccines, and it's tough to keep up if you have a day job. We thought that you could unpack all the new announcements that we've heard recently. On May 27th, the U.S. Health and Human Services Secretary RFK Jr. announced that COVID-19 vaccines will no longer be universally recommended for healthy children and healthy pregnant women. 2 days later, the CDC updated the childhood immunization schedule, and some are now saying the two don't entirely align. What exactly changed in the recent CDC update for both healthy children and healthy pregnant women? Do you think this will significantly impact immunization rates? And what issues do these changes raise?
As far as the CDC update, on May 29th, the childhood immunization series was updated for children 6 months to 17 years of age, and it was changed to indicate a shared clinical decision-making recommendation, specifically for those in that age group that are not moderately or severely immunocompromised. So potentially healthy children could still fall within this bucket and be eligible for the vaccine via a shared clinical decision-making process. And the language that they include on there is basically saying where parents present with a desire for their child to be vaccinated and informed by the clinical judgment of a healthcare provider and personal preferences and circumstances may receive the COVID-19 vaccine. As far as healthy pregnant women go, this one is still a little bit unclear. Some of the other vaccine schedules, when you look like on the adult or the adult schedule for those that have medical conditions, also indicate a date updated on May 29th. As far as the schedule for those with medical conditions, pregnancy is one of the conditions listed on that page, and it just notes that no guidance is available. That is still something that's unclear, and hopefully when ACIP meets later in June, we'll have a little bit more clarity around what those recommendations look like. In terms of vaccination rates, it's unclear right now what the impact of this is actually going to look like. Current vaccination rates in these two populations for both children and pregnant women are relatively low with the COVID vaccine. If we look at what is considered to be up to date for the most recent 2024-2025 vaccine. So in children 6 months to 17 years of age, approximately 13% received that vaccine or are considered to be up to date. And for pregnant women, that's a little over 14%. Both of those are quite a bit lower than what we see for influenza. So for example, in that same population for children, approximately a 49% vaccination rate, and then pregnant women, 38% for the influenza vaccine. As far as shared clinical decision-making goes, with a shared clinical decision-making recommendation, this has the potential to maybe not have as big of an impact on vaccination rates, if that's the case. But the caveat to this is insurance coverage for the vaccines. And one concern that I've heard is depending on the verbiage, a lack of payer coverage could lead to health disparity from an equity standpoint. I do want to also note that, at least from the CDC standpoint, they have stated in the past that shared clinical decision-making recommendations are required by their interpretation to be covered by private insurers under the Affordable Care Act. But payer interpretation of that statute may vary. That is something that remains to be seen. Another concern that I've heard with this announcement specifically is around pregnancy, and that is because pregnancy, it's still listed as a risk factor when you go to the CDC page on medical conditions that place you at risk for more severe outcomes with COVID. And there's also evidence to show that the vaccine, when given during pregnancy, provides protection to infants less than 6 months of age as well. Additionally, the American College of Obstetrics and Gynecology still recommend COVID vaccine during pregnancy. Given that the current immunization schedule from CDC was updated and says no guidance, we have to wait and see what happens at this upcoming ACIP meeting towards the end of June and see if we get any more information and guidance at that time.
Since it's still a little uncertain what's going to happen in terms of recommendations for healthy pregnant women, I want to focus more on the healthy children aspect. If I understood you correctly, what has changed is it used to be universally recommended for healthy children. And now that has been backed off where it's not necessarily universally recommended, but it is a shared clinical decision between a parent and a healthcare provider. So it's more of an informed consent decision.
Yes, that's right.
All right. Listening to what you said, it sounds like the COVID-19 vaccine influenza uptake is fairly low right now in both those patient populations that we were talking about. Probably not necessarily going to change too much about what's already happening, but certainly going to make payer decisions very difficult. And it's interesting what the CDC's interpretation is of the Affordable Care Act. Stay tuned. We'll know more about the payer situation in coming months. About healthy children, I certainly want to discuss what some of their patients may have concerns about. And there's two main issues that I've heard or read about from the lay public about this particular decision. The first is, are we going to put healthy children at risk for more severe illness by removing that universal recommendation? And the second is around transmission, especially the fear that children may now spread COVID-19 more readily to their loved ones. Looking at where we're at in 2025, are kids still at high risk for severe illness? And what do we know about the vaccine's ability to reduce transmission?
In terms of severe illness, generally think about mortality and hospitalization. When we look at mortality rates, overall, the proportion of deaths in children are low compared to the other age group. For example, approximately 0.5% or less, depending on the age group in children, for the total proportion of deaths, where the majority of deaths remain in older adults, 65 plus, around 85% or more. In terms of total cause of death in the US in children 0 to 17 years of age, or where it ranks in the cause of death, it ranked number 8 in 2021 and 2022, but has declined to number 12 in 2023. As far as hospitalization rates go, the most recent data that we have from October 2024 to 2025 for children less than 17 years of age, approximately 4.3% of the total COVID-19 associated hospitalizations were in this age group. However, when we also look at this age group, the overall hospitalizations have decreased from what we've seen in previous years. And for adolescents 5 to 17 years of age, the hospitalization rate with COVID was actually lower than what we saw for flu most recently, but in the 4 and under, which typically are a little bit at higher risk compared to the older age groups in the pediatric population, still saw similar hospitalization rates for flu and COVID. Another serious potential outcome that we saw more commonly early on in COVID in this population is something called MIS-C, or multi-system inflammatory syndrome in children. It's a rare but serious condition involving multiple different organ systems, usually seen within 2 to 6 weeks after a COVID infection. Really saw the peak of this in late 2020, early 2021, but has decreased quite a bit, about 98% less most recently compared to what it was during the peak. But we do still have cases that occur. For 2023, the data that I've seen has showed about less than 150 cases that year. So it definitely still happens, but it is decreased from what we initially saw. Your question about transmission, this one is a little bit more difficult to provide a definitive answer. We know that the COVID vaccine, it's not a sterilizing vaccine. There's no guarantee that it's going to prevent infection or transmission. It might reduce those risks of those things happening, but it doesn't necessarily prevent them. And the data on transmission are conflicting. We have some evidence to show that there may be benefit, but we also have some other data that is looking at more recent variants and has found similar viral loads in those that have received the vaccine compared to those who haven't when they get infected. And viral load is something that influences transmissibility. Higher viral load, more likely to transmit the virus. If someone that did get the vaccine had a lower viral load, that could affect transmission, or if they avoided infection, that would obviously affect transmission. It's kind of hard to say, does it definitely prevent transmission? It might have an impact, but the most compelling reason to get the vaccine is to reduce the risk of severe illness for that individual who's receiving the vaccine.
I appreciate that answer. I do not want to underplay that severe illness can still occur in healthy children. Listening to your answer, it seems to me that the severity of the illness has attenuated in healthy children over the past 5 years, in spite of low vaccination rates. we've become immune experienced to COVID-19. It sounds like, fortunately, we've had attenuation of the severity of illness. One of the things I want to emphasize to our listeners is we are talking about healthy children. You mentioned at the top of the podcast that this recommendation does not apply to children that have risk factors for placing them at higher risk of severe illness. The CDC publishes a list of conditions that places patients at higher risk of experiencing severe illness, and those cut across both pediatric and adult patients. Are there specific risks for pediatric patients, factors outside of that CDC list that place them at high risk for having severe illness?
For pediatric patients, the risk factors are pretty similar to what you'll see for that overall risk, but we do have some data that look specifically at pediatric patients in terms of their risk factors. There was a paper in 2024 that characterized the deaths of the pediatric patients that we saw between 2020 and 2022, and approximately 68% of the children who died to COVID had at least one underlying condition, with the most common conditions including nervous system disorders, congenital abnormalities, obesity, respiratory diseases, and neurodevelopmental disorders. As far as hospitalization goes, the data around hospitalization that we have seen in the most recent season, the majority of the children that were hospitalized had at least one underlying condition, about 59% in that age group. And similar risk factors to what I just mentioned above for that study that looked at mortality were also noted when they were looking at risk factors, but also included things in addition to that, such as prematurity, cardiovascular disease, metabolic disease, immunocompromising conditions, blood disorders, and feeding tube dependence. In terms of actual rates of hospitalization, in addition to risk factors, children under the age of 6 months also fall into a high risk in terms of just rates of hospitalization and remain higher than those of any other age group except for adults greater than or equal to 75.
Question for you about recent changes to the CDC schedule. I do not believe in crowdsourcing decisions. So that's not what this question is about. But I do believe that all nations have the same set of data to evaluate. In terms of Western nations, is the United States an outlier for not universally recommending the COVID-19 vaccine for healthy children and making no recommendation in healthy pregnant women?
For the recommendation to not universally recommend the vaccine in healthy children, it is not an outlier when you look at a number of other countries, such as UK, Canada, Australia, as well as World Health Organization guidelines. But in terms of pregnancy, if that ends up not being a recommendation or pregnancy gets removed as a risk factor, that would be a situation where we would possibly be an outlier with what many other countries are doing. Most of those other countries that I just mentioned, as well as World Health Organization guidelines, still do recommend the COVID vaccine in pregnancy and note that it is a risk factor for more severe outcomes.
We will have to stay tuned to see what ACIP determines in regards to healthy pregnant women. That covers the major announcements from the last 2 weeks. I'm going to take us back to May 20th, when the heads of CBER and the FDA published an article in the New England Journal of Medicine titled, An Evidence-Based Approach to COVID-19 Vaccination. We'll drop a link to it in our show notes because it is freely available. In this article, they outline a brand new regulatory framework for COVID-19 vaccine approval that the FDA plans to move forward. Can you walk our listeners through the highlights of that framework?
At a high level, it's outlining the rationale for their changes in vaccine policy specific to COVID-19 vaccine approval. And they really just define high-risk groups, including adults 65 and older, as well as individuals 6 months and older that have risk factors for severe outcomes. The criteria for approving vaccines moving forward for that population or those populations that are at higher risk, they note that immunogenicity data are going to be sufficient for making decisions around approving the COVID-19 vaccines. But for healthy persons without risk factors between the age of 6 months and 64 years of age, they discuss anticipating a need for randomized controlled trial data prior to BLA or biologic license application approval.
This framework absolutely represents a shift in policy. Right now, just as a reminder to our listeners, updated formulations of the COVID-19 vaccine are approved primarily on immunogenicity data each season. Based on what you just told me, John, it sounds like for some populations, there will be a requirement for randomized controlled trials moving forward. I don't know if it's each season or every few seasons. Walk our listeners through how the FDA is thinking about implementing this change, since it's fairly difficult to conduct an RCT in a timely fashion.
The initial population that is put forward, potential ideal starting point, includes healthy adults 50 to 64 years of age. And the rationale for this is that there's less global consensus around this population in terms of where that actual age cutoff goes for considering adults that aren't otherwise at risk due to medical conditions to be at higher risk. They also go on to outline some recommendations around trial design and specify endpoints that they would want to see. So the preferred primary endpoint in the trial is symptomatic COVID-19 infection, with special attention paid to several secondary endpoints, including severe COVID-19, hospitalization, and death. So looking for clinical outcomes as opposed to immunogenicity outcomes in this population.
It's important to note that normally a shift in the regulatory framework for COVID-19 vaccine approval might involve deliberation by the FDA Advisory Committee, which is the VRBAC, or the Vaccine and Related Biologic Products Advisory Committee, although I will say it's not always been convened around COVID-19 vaccine booster decisions. This committee met on May 22nd, and the new regulatory framework was not on the agenda. So what did they actually discuss during that meeting?
At the most recent VRBAC meeting, the primary focus was on strain selection for the 2025-2026 COVID vaccines. They ultimately recommended to have a monovalent vaccine composition with a JN1 lineage strain, which is similar to the vaccines that we already have on the market for 2024 to 2025, with Novavax being JN1, Pfizer Moderna being KP2, which is within that JN1 lineage. As far as I know, kind of remains to be seen what the actual compositions will be. The recommendation was more from a JN1 lineage standpoint. The most current circulating strain, or the most prevalent circulating strain, is LP8.1, which also falls within that lineage, which represents about 70% of what we're seeing right now, or at least the data that were reported out on May 10th. The World Health Organization also recommended similar strain selection, just JN1 lineage, saying JN1 or KP2 could be appropriate, with LP8.1 potentially being a suitable alternative, and LP8.1 may offer similar or modestly increased cross-reactive antibody responses to the currently circulating JN1 variants. But ultimately, strain selection was the focus, and the vaccines that we're going to see are going to be similar to probably what we had in the previous year, being JN1 lineage strains.
Interesting. All right. For our listeners still following along with all these changes, I would say there's one group we have not touched on yet, and that is healthy adults between the ages of 19 and 64. And this group wasn't mentioned in RFK Jr.'s announcement. And so far, there haven't been any updates to the adult CDC immunization schedule either. Now, I know at the top of the podcast, John, you mentioned about an upcoming ACIP meeting. What do you think is going to be discussed at that meeting? Do you think we're going to have discussion around healthy adults?
The upcoming meeting is scheduled for June 25th to June 27th. And that meeting, we should see votes around recommendations for COVID vaccines. Exactly what the language is going to be or what the votes are going to encompass, not really sure yet. The primary discussion from April was just a transition from universal to risk-based recommendations and what that might look like. At the time, the majority of the work group for COVID-19 vaccines did favor that transition to risk-based recommendations. With everything that we've seen lately, it's probably reasonable to expect that that's the direction we're headed. However, the majority of the work group also discussed being in favor of permissive language to allow anyone who wanted to receive the vaccine to still be able to do so. It remains to be seen as to what they recommend and what the language entails. Maybe it'll look like a shared clinical decision-making or some other form, but I hope that when we get those recommendations, we'll have clarity around both healthy adults as well as healthy pregnant women to provide additional guidance from that standpoint.
Vizient, as soon as we know what is discussed on June 25th to the 27th, we'll put together a Minute Market Insight to inform all of our listeners about what happened during that discussion. John, we've discussed a lot. Any other things or information that you feel still require some clarity around COVID-19 vaccines?
One thing that just comes to mind is now that we have the Novavax vaccine that was officially FDA approved, all 3 vaccines on the market are approved for 12 and older. And the use for the Pfizer and the Moderna vaccines in the less than 12 population remains under EUA, or emergency use authorization. So I'm curious to see what that looks like moving forward, if those EUAs are updated or what is going to happen with that.
I have that question too. It'll be very interesting, certainly with the new regulatory framework that has been rolled out as well. So thank you so much, John, for joining us today on Verified RX podcast. I learned a lot, and I hope our listeners did too.
Yeah, thank you.
Join us for more Verified RX podcasts. Subscribe today. Like us. Send us your comments. We'd love to hear from you. Verified Rx is a prescription for success and is brought to you by the Vizient Center for Pharmacy Practice Excellence. Thanks for listening.